Hey guys, it's Dr. Abraham and Bianca here at Valencia Medical Center, and we're coming with the Live at 5
With the Live at
to
5.
answer some of your questions.
Hi guys, so today's topic is the power of PRP. So I'm going to be asking Doctor some questions and he will be filling you in on what the
answers
power
to
of
these questions.
PRP actually is. So Dr. A,
Alright.
what is PRP and how is it performed? And is PRP also painful?
Okay, so PRP stands for platelet-rich plasma, and it's basically a component of the blood. So it's performed by first getting the person's blood and then concentrating using a special machine to concentrate the platelet-rich plasma, and then doing the treatment. And the process is going to be slightly different depending on what treatment we're doing, whether we're doing joint injections or we're doing face injections or microneedling or hair transplants. But it's using your own blood to try to get the platelets, which have a lot of growth factors and cytokines in them, and use that to heal the body, simulate the body, simulate the skin for skin rejuvenation, that kind of stuff.
All right. So our first topic with the PRP is the joint injections and injury. So for joint pain and injury.
Okay.
Yeah. So how many injections would a typical person need for joint injections, and what joints do we primarily focus on while we're here in our clinic?
How many injections will the person need will depend on the person, but for most people it's only like 1 or maybe 2 injections.
Okay.
At least to kind of treat the issue initially. There are situations where we might need to do a little bit more, but the majority by far with 1 or 2 injections are going to see a lot of improvement. What was the second part of the question?
The second part is like, what are the joints that we primarily focus on here for joint injection?
By far, I would say the shoulder and the knees are the 2 most common. Maybe they're like 50-50 or even 60-40 in terms of like knees than shoulders. So probably knees, shoulders. We also do a lot of elbows. And then these are the 3 main ones, I would say. Elbows, knees, shoulders. But sometimes we do also hips, ankles, wrists. So other joints can be done too.
Someone was asking, can we be allergic to any of the solutions that are injected?
Not typically. I mean, sometimes, not the PRP. You're not going to be allergic to the PRP. It's your own blood. We usually numb with lidocaine and things like that. So, other parts of the procedure, like the numbing, possibly somebody might be allergic to lidocaine. Most people who are allergic to lidocaine would know, but I mean, even then, you can skip the numbing and it might be a little bit more painful, but it's tolerable even without numbing. So not the PRP itself. Again, numbing, other stuff we're doing while we're doing the procedure. Sometimes use a little calcium to activate the PRP, but not the PRP, no.
All right. So we know that there's been a lot of talk about stem cells. Can you explain the difference between what PRP is and what stem cells are?
Alright, so they are different, but there's definitely a lot of similarities and some differences. PRP is platelet-rich plasma, and we are taking the platelets from the blood, and we're using it to rejuvenate or heal a joint or skin or something like that. With stem cells, the concept is actually kind of similar, but we're not going after the platelets, we're going after the stem cells. And a lot of times people get stem cells. It can be gotten from a few different sources, but the most common is bone marrow. Also, sometimes we do it through the fat cells. So, and then there's embryonic stem cells. So even within stem cells, there's different, subcategories. I'm not gonna go into full details into each, but generally speaking, if you're using your own PRP versus if you're using your own stem cells, it's gonna be a little bit more invasive to do the stem cells for sure. If you're going through the fat, it's kind of like a mini liposuction, or if you're doing through the bone marrow, which is what's most often is done through the bone marrow. We actually have to kind of dig through the bone to get the bone marrow out. But it can be a little bit more potent if you do use stem cells. For a lot of clients, the process is to start with PRP, see if that does the trick, kind of monitor the healing from there, and then if needed, sometimes step number 2 can be stem cells. Because in a lot of ways they are meant to do the same thing, even though they're different types of cells. In both ways, we are injecting the joint to try to start that repair process, to try to heal, heal the joint. So they are meant in many ways to do the same different things. They just do it at kind of different levels, and the process is a little bit different.
All right. So for the joint pain and injury, how long does it take usually for PRP injections to work?
It does vary. We do, kind of the expected timeline that we give most of our clients is going to be like, somewhere between 8 weeks and 16 weeks. It's usually a gradual improvement. Honestly, a lot of the clients within 4 weeks, they'll be noticing some difference, but then they'll just kind of continue to improve at 8, 10, 12, 14 weeks. We do have a lot of clients who honestly within a couple of weeks they're feeling a lot better. So that's kind of like a best case scenario, and it does happen. That within 2 weeks you can feel significantly better. But those are kind of like the lucky clients who get kind of the best response to it. For the majority of the clients, I would say it's going to be 4 weeks. It's not going to be the full improvement, the full effects at 4 weeks, but that's when you start seeing some improvement, and then it kind of continues over the next 8, 12, and 16 weeks.
Fantastic. How long can a patient expect to actually be in the office, and then will they need to have a ride home, or are they generally able to provide their own transportation?
It will depend. I mean, if someone is doing knee, it's advised if possible to have somebody kind of drive them just in case it hurts a little bit more. But that being said, it's a simple process. Most people are going to be fine even after the treatment. It might flare up a little bit as if they just had like a long walk or something, so it might be a little bit annoying, but it's not going to be where they have to be like in bed, or they can't move it, or they can't use it, or anything like that. The process is going to be anywhere between depending on what we're doing, whether we're doing something cosmetic or we're doing a joint. I think we're focusing more on the joints right now. It's probably going to be around like, maybe an hour to 2 hours, an hour and a half, something like that. Again, depending on what we're doing exactly, the joint, how we're doing it. We do use ultrasound when we do our injections here, which takes a little bit longer. Not honestly longer, it takes a little bit longer, but it makes it, for kind of like a more detailed visit. So yeah, between 1 hour to 2 hours from the time they walk in for us to get their blood, process the PRP, which we do here in-house.
Okay.
We have a great machine for that, and then inject it.
All right, so let's move on to our next category, which is PRP for hair.
Okay.
And will the PRP work on balding areas? Where do you generally inject for PRP hair?
For balding areas, so it depends if the area is in the process or if it's already kind of, bald. But it really does, because the PRP isn't meant to grow new hair or anything like that. So if somebody doesn't have any hair follicles in the area anymore, the skin, because the hair follicle kind of comes out through the skin, the hair follicle is completely gone, skin is closed, then PRP at this point, really most injections aren't going to do anything. You do need a hair transplant. But that being said, usually that happens as a process. People have a full hair, and then they kind of go through the process where their hair is getting thinner, they are losing hair, but not fully lost all their hair, and that's where PRP can be beneficial. It's meant to help the hair that's still there. It's meant to help strengthen the hair, stop the hair loss, reverse some of the hair loss. Sometimes we do PRP and people, they're like, I swear it's new hair. Usually what happens is, if people have like small like baby hair, where it feels like there's no hair, you can almost see it, and then you do the PRP and then the hair kind of gets a little bit thicker and you can start to see it. So a lot of times people think it's growing new hair out of scratch because it almost felt like there's no hair there at all, and now they see some hair. But typically speaking, it's just like really stopping the hair loss, reversing some of that by strengthening the hairs that we're thinning and making them, helping them get thick and healthy again.
Okay.
That's what it does.
Will a person's head be sore and tender after?
Not usually, not a lot. Some people do experience like a mild headache, to be honest, afterward, but it's nothing that you can't really get a handle on. We tell our clients if needed, they can have a Tylenol after they get a little headache. Most of the clients that come back, they're like, didn't even need to take the Tylenol, even the ones who are like, I got a little mild headache for a couple of hours after it goes away, so nothing crazy.
And when can we have a client expect to see results? And is there a number of treatments that they should be doing, or will they see results at least after the first treatment?
Again, it will depend on the person. I can give you kind of some general principles. For a lot of people, for most people, they're going to need a series of treatment, maybe 2, 3, or even 4 treatments, depending on what we're trying to accomplish and what we're starting out with. And it does take some time to really see the kind of like full reversal with the hair treatments. It is a gradual process, just like most PRP treatments. It's not going to be like where you're going to wake up one day and everything is different. It's going to be like a 1%, 2% improvement every day for over a long period of time. So it can take 5-6 months to kind of see the effects of a hair treatment.
Okay.
So you do have to be a little patient.
All right, and then I know some patients come in and they take medications for hair loss. After they do the PRP treatment, should they continue taking medication or whatever they do for it?
We usually go through that stuff because there's going to be some variation from client to client, but generally speaking, PRP isn't going to interact with most of these other treatments because it's your own blood, your own platelets. So it's not like, definitely when you start a new medication, you have to kind of make sure that there isn't any drug interactions, between what you're already on and that stuff. But with PRP, it doesn't tend to be a problem because it's not going to interact, with most of the medications out there. It's your body's own platelets, so they can, generally speaking, continue whatever program they were on before.
All right. Is there any side effects to the PRP hair treatments?
Again, it's your own PRP, so there isn't really. It's a very safe treatment overall. We've mentioned already. Sometimes people have a little bit of a mild headache after from the injections. We always want to keep the area clean because we kind of went through the skin. We don't want the skin to get infected from all the needle pokes and that